Hi, Dr. Gardner here, and I'm happy to see you, and hopefully you can see me as well. And for week 3, we're looking at research problems and purposes, and this is one of the most exciting aspects about doing research that you can possibly imagine. First of all, we look for research problems and purposes, and a problem is an area of concern, and basically I can sit here and read it to you, or I can show you or tell you about some other research that is being done. And one that I was most interested in was I was looking through the Journal of Nursing Scholarship and found an article here related to, this is Girlhood Betrayals of Women, Childhood Trauma Survivors in Treatment for Addiction. That's a huge mouthful as far as what it is that they're looking at. And when I opened it up to look and see exactly what the problem was that they were looking at, for the most part, it was to provide and to explore trauma survivors' perspectives on what really happened to them and how they've coped with it and how they've dealt with it over the years. And it was a massive study. It's in the Journal of Nursing Scholarship, and this is a 2016 May edition. And for the most part, what they did is to talk to a lot of women who had had sexual trauma or an unhappy childhood or anything that was really traumatic for them. And then from doing a study like this, they looked at the problem. And basically the problem is that if you don't really identify what the main issue might have been at one time, how can you really address it later? And to know how to work with people that have had, trauma in their background. Some of the other articles that you look at when you look at different studies, and these are all studies that nurses have done over the years. And there were a couple of them in this issue that really got me excited and that I really wanted to look more into. And let's see, effects of multivitamin supplements on cognitive function and serum homeocysteine levels and depression, and whether taking multivitamins or homeopathic medications help to improve the cognition or the mood levels of elderly people. And yeah, they did find a good report on that, in that in fact there's even something that I noticed the other day that was out on the in the homeopathic section, 5-HTP, and it's supposed to elevate the moods and everything. So you look at the problem. The problem is that a lot of older people have depression, and they're not as active or engaged in life as what they could be. So in looking at what someone can do as far as a nurse, and especially for over-the-counter medications, it's a good way to start. Looking at the problem statement. The problem statement is that a lot of elderly people have reported depression, and especially in their later years, and especially if they are either alone, widowed, single, or they don't have a good social group. And then when you look at the significance, the significant research problem, does it have the potential to generate or refine relevant knowledge that directly or indirectly affects nursing practice, and especially our patients too? We know an awful lot about our patients when they come in. We know their vital signs. We know their reason for coming in. We've looked at their history, but do we really know what's going on with that person? And how does this affect or influence nursing practice? If you've got a patient who, by their own admission, has always been very staunch and very strong, and who lives alone and very self-sufficient, is that person at risk for falls? Yeah, you betcha. That person will not want to bother you. They'll want to go ahead and do it themselves. Even if they were a double amputee from the night before, they're still going to try to get up out of that bed. So the more that we learn, the more that we know about our patients, the more that we can better care for them. Feasibility of the problem, determined by examining the patient, the circumstance, and everything else. When we look at problems that we want to do something about, and for you it might be the infection control, especially with the outbreak of CRE, MRSA or any of the other infections that are now going around. Here in Florida, we've had a huge outbreak of flu, and it seems like it just hits overnight. And I don't even know that Tamiflu is doing all that good for it. And those that did have the flu shot, supposedly this year's flu shot did well, but it's still not 100% because by this time it's mutated and mutated many times over. So when we look at problems, when our patients or staffing or anything that pertains to nursing, we look at the problem, and then we also look at everything else and how much can we really put into this. And I did a research project over at one of the local hospitals here in Orlando, and it was related to falls. And for the most part, their fall rate had really skyrocketed. And of course, they live in an area where there's a lot of elderly patients, and the hospital's been there for a long time. And so they do have a lot of elderly that are there, and with new hips, a lot of orthopedic surgery and everything else. And they looked to see why these patients kept falling. And for the most part, it was because of, not being able to get up or realize what was happening to them. And also, too, they would fall because the last thing that the nurse would say when they left the room is, "Can I help you with anything else? Do you need to go to the bathroom?" And of course, by this time, the patient doesn't want to bother the nurse, so naturally, no, they don't need to go to the bathroom. They also had a problem, too, with early dementia in Alzheimer's patients who were wandering. And we did a lot of research on it. We did find that if you do put a black strip, like a piece of duct tape or something like that, in front of the door, patients will not go out their door and start wandering throughout the hospital. There was even a really nasty instance to where the patient got out of their room and got in bed with somebody else that didn't appreciate having a midnight visitor. So, I kind of laugh about it, but, they really thought that they were at home and in their own bed and getting into bed with their loved one when indeed they weren't. Research objective and question. Research objection should be a clear, concise, declarative statement expressed in the present tense. We want to find out what's going on, what makes a difference, and the objective has to be related to what it is that we can really find out in regards to what it is that's being studied. We always have a hypothesis. Even my granddaughter, she's 11 years old. We worked on a project last weekend, and her hypothesis was that a ball, or in cold weather, a ball would bounce higher than it would in hot weather. And so she did her own experiment on it. She even had her own poster board. She had her hypothesis written out on the very top, and we did go ahead and look it up, and we did find that balls in cold weather would bounce higher because of the amount of gas that's within it that would be activated rather than making it flat. So anyway, she's 11 years old and in the 5th grade and doing hypothesis and research. So your hypothesis is a formal statement of the expected relationship between two or more variables. Her variables were a cold ball versus one that was hot because of the weather, and associating the hypothesis relationships amongst the variables. And for the most part, I like this little cartoon below. It either grew or we shrunk. And sometimes that's a matter of trying to figure out what happens in research. The null hypothesis is used for statistical testing and for interpretive analysis and outcomes. And it's converse of the research hypothesis. When it's used when we believe that there's no relationship between the two variables. And the example is, where have all my stocks gone? And the interterrestrials have taken them, or what's even better is that the dryer ate them. So anyhow, we can use a lot of different variables. Null hypothesis is the symbol for that is HO. And I am going to have a statistical term exam, not really an exam, it's more of a, more of a quiz. And thankfully, in your book, you do have the glossary. You can look things up. It is open book, and it does help to cement what it is that you think, what this might mean, or what is a hypothesis, what is a null hypothesis, etc., etc. And basically, it's just used for testing, and it's the converse of the research hypothesis. Okay, we also come to a decision-making tree, and whether we want to accept or reject the null hypothesis. And for the most part, when we say that the null hypothesis is true, that means that it's a correct decision. And if you reject it, then it's a type 1 error. And if you reject it outright, then it's a type 2 error. And this gets down to the fine nitty-gritty. Look at it in your book, but it's not going to be all that significant when you take the quiz or when you need to know certain things. It just helps that you have a baseline understanding as to what a null hypothesis is and some of the other terms that we'll be going over. Variables. We have independent variables, we have dependent variables, we have extraneous variables. An independent variable is an intervention that's manipulated or varied to create an effect on the dependent variable. The dependent variable is any changes that might be caused by something, by the independent variable. And I know that sounds confusing. It's really explained well in your book. And let me just move this out of the way over here so that you can see. Basically, it's cause and effect and other variables that do affect what's going on. We look at an independent variable, and then we also look at what's going on, which becomes the dependent variable. And so the two of them are somewhat there together. And I'm going to put it back over here too. Whoops, about how it affects the change and on the dependent variable. The independent variable may be that it is stormy looking outside, and is that going to cause a change? I don't think so. Basically what it is that your independent variable has to do with looking at something that is seemingly not having a relationship, and yet at the same time trying to decide if indeed it does. Independent variable is what I change for the dependent variable, or what I observed becoming the controlled variable. And what I keep is as the same. And when you look at various things in your book, or throughout your textbook and everything else, that one article that I mentioned to you about the homeopathic medications, and the dependent variable is a person. The independent variable would be medications, homeopathic medications. Does that improve their cognition? Does that improve their basically, does it change their behavior in any way? Are they less depressed? Are they more aware? And everything else. So when you look at all these terms, kind of keep in the back of your mind that, you know, just a little understanding of it. I'm not going to ask you a lot about it or expect that you're going to be a nurse researcher. Hold on to your book. It might surprise you to know that eventually, sooner or later, you just might be using that book. Okay, I believe this